Question 1. Ethical dilemmas in medical research. A research team is conducting a clinical trial to test the efficacy of a new cancer treatment. The trial participants have been given the necessary information and informed consent has been obtained. However, midway through the trial, it is discovered that the drug shows promise but has significant side effects that could impact the patient's health. What is the appropriate course of action for the research team to take in? Situation A. Continue the trial without informing participants about the side effects, as halting it could cause delays in the research. B. Inform the participants about the potential side effects and offer them the option to withdraw from the trial. C. Allow the trial to continue without any further changes to the protocol. D. Withhold information about the side effects from the participants as they may not understand the technical details. Answer. B. Explanation. Informed consent is a fundamental ethical principle in medical research. The participants have the right to be fully informed about any new risks, especially if the new information may impact their health. The ethical obligation of the researchers is to ensure transparency and allow participants to make informed decisions about continuing or withdrawing from the trial. Continuing without disclosing the risks or withholding important information would be a violation of both ethical standards and the principle of respect for patient autonomy. Question 2. Medical malpractice and negligence. Dr. Laurent is performing a routine surgery on a patient. During the procedure, Dr. Laurent inadvertently leaves a surgical instrument inside the patient's body, which causes an infection and further complications. The patient suffers significant harm as a result. Which of the following best describes the legal principle at play in this case? A. The principle of informed consent, since the patient was not fully informed about the risks. B. Medical negligence, as the doctor failed to meet the required standard of care during surgery. C. Strict liability, as the doctor's actions are automatically considered negligent without needing to prove fault. D. Medical malpractice, as the doctor violated the patient's rights by causing harm during medical procedure. Answer. B. Explanation. The situation described is an example of medical negligence. Medical professionals are required to provide care that meets the standard expected within their field. Dr. Laurent's failure to ensure that all surgical instruments were removed constitutes negligence, as it deviates from the standard of care expected in the surgical procedure, while medical malpractice involves breach of the duty of care. Negligence specifically failure to adhere to standards that result in harm. This scenario highlights the importance of following established protocols to prevent avoidable injuries during medical procedures. Question 3. Scenario 1. Informed consent. Mr. Dupont is a 56-year-old man diagnosed with early-stage prostate cancer. His physician discusses treatment options, including surgery, radiation, and chemotherapy. The physician provides information about the benefits, risks, and potential side effects of each treatment. However, Mr. Dupont is overwhelmed by the information and expresses confusion about the options. What should the physician do in this scenario to ensure compliance with ethical and legal standards regarding informed consent? A. Proceed with one of the treatments Mr. Dupont agrees to, as he has been given the necessary information. B. Provide Mr. Dupont with additional time to consider the options and answer any remaining questions. C. Recommend the treatment option that the physician personally believes is best for Mr. Dupont. D. Ignore Mr. Dupont's confusion and proceed with the treatment he initially mentioned. Answer. B. Explanation. Informed consent requires that the patient fully understands the risks, benefits, and alternatives to the proposed treatment. If Mr. Dupont expresses confusion, it is essential that the physician take the time to ensure that the patient understands the options. Providing additional time answering questions and addressing concerns is necessary to fulfill the ethical and legal requirements of informed consent. This process ensures that Mr. Dupont can make a decision based on his values and it respects his autonomy. Rushing or bypassing this step would violate both ethical principles and legal standards for patient care. Question 4. Professional misconduct in medical practice. Dr. Morau, a well-known cardiologist, has recently been facing financial difficulties. In order to maintain his income, he begins recommending unnecessary diagnostic tests and treatments to patients that are not medically warranted. Which of the following best describes the ethical violation occurring in this scenario? A. Breach of patient confidentiality, as Dr. Morau is discussing his patient's conditions inappropriately. B. Conflict of interest, as Dr. Morau's financial situation is influencing his medical recommendations. C. Negligence, as Dr. Morau is failing to adhere to medical standards by recommending unnecessary tests. D. Medical malpractice, as Dr. Morau has intentionally harmed the patients by recommending unnecessary treatments. Correct answer. B. Explanation. Dr. Morau's actions represent a clear case of conflict of interest where his personal financial concerns are influencing his professional decisions. Medical professionals are required to act in the best interests of their patients, and any external factors, such as financial gain, should not affect clinical judgment. Recommending unnecessary treatments for personal financial benefit compromises patient care and violates ethical obligation to provide services based solely on medical need. Conflict of interest can undermine patient trust and lead to unnecessary harm or costs. This action is a breach of ethical standards, though it might not yet constitute medical malpractice unless actual harm occurs. Question 5. Legal framework of medical practice in France. Under French medical law, which of the following statements is true regarding the physician's role in the context of medical liability and patient care? A. Physicians are automatically held liable for all negative outcomes, regardless of the circumstances surrounding the treatment. B. The physician has legal duty to ensure all medical decisions are made exclusively based on scientific evidence, without regard for patient preferences. C. The physician is not legally liable for complications that arise during procedures that were necessary for the patient's treatment. D. Physicians may be held liable for failure to obtain informed consent, even if the outcome of treatment was favorable. Answer. D. Explanation. In France, medical liability extends beyond the outcomes of treatment to include whether informed consent has been properly obtained. Even if the treatment leads to a positive outcome, failure to provide patients with adequate information regarding the risks, benefits, and alternatives to treatment can result in legal liability for the physician. This is in line with the legal framework that ensures patients have the right to make informed decisions about their care. Informed consent is a crucial legal and ethical obligation in medical practice, and failure to comply with it can lead to significant legal repercussions, regardless of treatment results. Question 6. Scenario on medical decision-making. Dr. Lefebvre is treating Mrs. Renault, a 75-year-old woman diagnosed with advanced chronic obstructive pulmonary disease. Mrs. Renault's condition is rapidly deteriorating, and her family insists on aggressive treatment to extend her life, despite the risks involved. Dr. Lefebvre believes that continuing aggressive treatment would cause unnecessary suffering with little chance of improving quality of life. How should Dr. Lefebvre approach this situation in light of medical ethics and patient autonomy? A. Respect the family's wishes and continue aggressive treatment to extend life, as they have right to make decisions for the patient. B. Suggest that Mrs. Renault undergoes palliative care, which would prioritize comfort rather than attempting to extend life, and explain the reasons for this approach to the family. C. Ignore the family's wishes and proceed with the aggressive treatment as initially planned, as the physician is ultimately responsible for making medical decisions. D. Recommend that Mrs. Renault be transferred to a different facility where aggressive treatments can be implemented, avoiding the conflict with her family. Answer. B. Explanation. Dr. Lefebvre faces a delicate situation in balancing the principle of patient autonomy with the ethical obligation to prevent unnecessary harm. While the family has a significant emotional stake in the treatment decisions, the physician must prioritize the well-being and dignity of the patient. In this scenario, recommending palliative care and explaining the reasoning behind it to the family respects Mrs. Renault's autonomy and on minimizing suffering in her final days. This approach reflects an ethical commitment to patient-centered care and ensures that decisions are made based on the patient's values and medical needs rather than family pressures or unrealistic expectations. Question 7. Patient confidentiality and medical record access. Dr. Bernard, a practicing neurologist, is treating a patient named Mr. Dupont for chronic migraines. Mr. Dupont's wife, who is concerned about his condition, requests access to his medical records without his consent. Dr. Bernard is unsure about how to proceed. Which of the following best describes the physician's obligations in this scenario according to French medical law ethics? A. Dr. Bernard should provide the wife with the requested records, as she is closely involved in her husband's care. B. Dr. Bernard may provide the wife with the records if Mr. Dupont verbally agrees, even without formal written consent. C. Dr. Bernard is legally obligated to refuse the request for medical records unless the patient has provided written consent. D. Dr. Bernard should provide the wife with the records if she is listed as emergency contact in Mr. Dupont's file. Answer. C. Explanation. Under French law, patient confidentiality is a fundamental principle, and medical records can only be shared with individuals authorized by the patient, typically through written consent. Now, even if a family member is involved in the patient's care, the physician cannot disclose medical records without explicit consent from the patient, unless there are extenuating circumstances, such as the patient being unable to give consent due to their medical condition. Dr. Bernard must respect Mr. Dupont's confidentiality and refuse the request from the wife unless consent is granted. This ensures compliance with legal standards and ethical practice surrounding patient privacy. Question 8. Informed consent and decision-making capacity. Mrs. Lemoyne, a 42-year-old woman, is being considered for a routine laparoscopic cholecystectomy. She expresses concerns about potential complications and the recovery time. The physician, Dr. Fontaine, explains the procedure risks and alternatives in detail, but notices that Mrs. Lemoyne seems distracted and not fully engaged in the discussion. What should Dr. Fontaine do next? A. Proceed with the procedure as Mrs. Lemoyne has verbally agreed to the surgery. B. Cancel the procedure immediately, as Mrs. Lemoyne may be unable to make informed decisions due to her distracted state. C. Reassess Mrs. Lemoyne's decision-making capacity, ensuring she fully understands the risks and benefits of the surgery before proceeding. D. Ask family member to make the decision on Mrs. Lemoyne's behalf, as she seems distracted and may understand the full implications of the surgery. Answer. C. Explanation. Informed consent requires that patients understand the nature of the procedure, the risks involved, and the available alternatives. In this scenario, Dr. Fontaine must assess whether Mrs. Lemoyne is fully engaged in the decision-making process and has the capacity to provide informed consent. If she appears distracted, it's essential to revisit the conversation and ensure she comprehends all necessary details before proceeding with the surgery. This aligns with the principle of patient autonomy, ensuring that decisions are made voluntarily and with adequate understanding, which is legal and ethical requirement in medical practice. Question 9. Ethical dilemma in reproductive medicine. Dr. Lefebvre is an obstetrician who is treating a couple that has been trying to conceive for years. They approach him for assistance with in vitro fertilization, but the procedure requires the use of a donor egg. The couple insists that the donor be anonymous and that no information about the donor be provided. Dr. Lefebvre has concerns about the potential psychological impact on the child. Future. Which of the following best reflects his ethical obligation in this scenario? A. Dr. Lefebvre should respect the couple's wishes and proceed with the anonymous donation without further consideration of potential psychological impacts. B. Dr. Lefebvre should refuse to perform the procedure unless the couple agrees to disclose the donor's identity to the child in the future. C. Dr. Lefebvre should inform the couple of potential psychological implications and offer guidance, while still respecting the couple's decision to proceed with anonymity. D. Dr. Lefebvre should inform the couple that anonymous egg donation is illegal under French law and refuse to perform the procedure. Answer. C. Explanation. In reproductive medicine, physicians are ethically obligated to consider the long-term well-being of the child as well as the parents' wishes. However, the psychological implications for children born through donor gametes, eggs or sperm are significant and must be discussed. Dr. Lefebvre should offer his professional guidance to the couple, explaining the potential psychological impact of not knowing one's genetic origins while respecting their autonomy and decision to pursue an anonymous donation. The physician should also ensure the couple is informed of any legal or ethical considerations related to the use of donor gametes, but ultimately the decision remains with the couple. Question 10. Emergency medical care and professional responsibility. Dr. Martel, an emergency physician, is treating a young woman, Claire, who has been brought in after a car accident. Claire is unconscious and has severe head trauma. Her medical records are unavailable and her family is unreachable. Dr. Martel is unsure whether Claire is allergic to penicillin. He needs to administer antibiotics to prevent infection. What should Dr. Martel do? Situation. A. Administer the antibiotics immediately, as the risk of infection outweighs the potential for an allergic reaction. B. Wait until the family is reachable or the records are available before administering the antibiotics to avoid any potential risk of harm. C. Consult with the hospital's legal team for advice on how to proceed without knowing the patient's allergy status. D. Withhold the antibiotics and focus on stabilizing Claire with other treatment until more information becomes available. Answer A. Explanation. In emergency situations, the physician's primary responsibility is to preserve life and prevent immediate harm. When patient is unconscious and unable to provide consent, medical professionals can act under the principle of implied consent, where treatment is provided in the best interest of the patient to prevent significant harm. In this case, the potential risk of infection from the head injury is more immediate concern than the possibility of an allergic reaction to penicillin. Dr. Martel should administer the antibiotics, as the urgency of the situation requires swift action. Once the patient is stable and more information is available, further adjustments can be made if necessary. This decision aligns with both medical ethics and legal standards regarding emergency care. Question 11. Ethical issues in end-of-life care. Mr. Gerard, a 75-year-old patient with terminal cancer, is in the final stages of life and experiencing severe pain. He has expressed a desire to die peacefully and requests assisted suicide, but his physician, Dr. Fournier, is morally and legally opposed to euthanasia. What should Dr. Fournier do in this situation? A. Proceed with Mr. Gerard's request, as it is his right to end his life on his terms. B. Refuse Mr. Gerard's request and refer him to another physician who might be willing to assist him. C. Offer Mr. Gerard alternative pain management options and explain the legal and ethical reasons for not fulfilling his request. D. Agree to the request and document the procedure as being done in Mr. Gerard's best interests. Answer. C. Explanation. In France, euthanasia is illegal and physicians cannot assist in a patient's suicide. Dr. Fournier has an ethical obligation to explain the legal limitations regarding euthanasia and offer alternative means to manage Mr. Gerard's pain and symptoms, while respecting Mr. Gerard's autonomy and acknowledging his suffering. The physician must adhere to the law and ethical medical practices. Alternatives such as palliative and pain management should be explored, ensuring Mr. Gerard's comfort in his final days, which aligns with the ethical obligations of medical professionals in end-of-life care. Question 12. Medical malpractice and negligence. Dr. Karen is performing a routine knee surgery on a patient, Mr. Luke, to repair a torn ligament. During the surgery, Dr. Karen inadvertently cuts a blood vessel, causing excessive bleeding. The patient requires a transfusion and extended hospitalization. Which of the following actions would best help Dr. Karen avoid liability for medical malpractice in this situation? A. Immediately document the mistake in the medical records and explain the situation to Mr. Luke and his family. B. Ignore the issue, as surgery is inherently risky and mistakes can happen. C. Attempt to cover up the mistake by altering the medical records to make it appear as if the bleeding was a natural complication. D. Fail to inform Mr. Luke's family of the complication, as this would only upset them unnecessarily. Answer A. Explanation. In cases of medical complications, full transparency is essential for avoiding allegations of medical malpractice. Dr. Karen should document the error honestly and communicate the situation to Mr. Luke and his family, ensuring they are fully informed of the situation, the potential consequences, and the next steps. Open communication is crucial in maintaining trust and showing that the physician is taking responsibility for the complication. This approach aligns with both legal and ethical principles in medical practice, including the duty to act in the best interests of the patient and to communicate any adverse events clearly. Question 13. Conflicts of interest in medical practice. Dr. Charan, a cardiologist, receives financial compensation from the pharmaceutical company to promote a specific medication during his consultations with patients. He prescribes this medication to many of his patients despite its relatively high cost and the availability of generic alternatives that are equally effective. Which of the following represents the best course of action to address conflict of interest in this scenario? A. Dr. Charan should continue prescribing the medication as he believes it is the best option for his patients. B. Dr. Charan should disclose his financial relationship with the pharmaceutical company to his patients before prescribing the medication. C. Dr. Charan should stop prescribing the medication to his patients as his financial interests are a clear conflict. D. Dr. Charan should recommend the medication only to patients who can afford it without informing them of his financial relationship with the company. Answer. B. Explanation. In situations where financial interests may influence clinical decision-making, transparency is crucial. Dr. Charan must disclose his financial relationship with the pharmaceutical company to his patients. This ensures that patients are fully informed and can make decisions based on their own values, including considering the cost and alternative treatment options. Full disclosure helps mitigate any potential conflicts of interest and ensures the integrity of the physician-patient relationship. By making patients aware of the financial compensation, Dr. Charan aligns with ethical guidelines surrounding transparency and patient autonomy. Question 14. Telemedicine and patient consent. Dr. Lamartine is providing medical consultations via telemedicine to patients in rural areas. One of his patients, Mrs. Thomas, is seeking advice regarding ongoing symptoms of anxiety. During the consultation, Dr. Lamartine provides a prescription for anti-anxiety medication but does not obtain Mrs. Thomas's written consent for the treatment. Which of the following is the appropriate course of action? A. Dr. Lamartine should ensure that written consent is obtained before prescribing medication as required by French law for telemedicine consultations. B. Dr. Lamartine can proceed with prescribing the medication without written consent, as verbal consent is sufficient in telemedicine. C. Dr. Lamartine should prescribe the medication without asking for consent, as telemedicine allows for more informal approach to patient care. Dr. Lamartine should advise Mrs. Thomas to visit physical clinic before prescribing any medication, as telemedicine is not suitable for prescribing medication. Answer A. Explanation. Telemedicine is subject to the same legal and ethical standards as in-person consultations, including obtaining informed consent for medical treatments. Dr. Lamartine must ensure that Mrs. Thomas provides written consent before prescribing any medication, which is a requirement under French law and medical practice regulations. This ensures that the patient fully understands the treatment plan, including the potential risks, benefits of the medication. Additionally, written consent protects both the patient and the physician legally, ensuring that there is no ambiguity about the treatment provided. Question 15. Professional misconduct and disciplinary procedures. Dr. Dufresne is a well-respected surgeon with years of experience. However, a series of complaints about his unprofessional behavior have been filed by several colleagues at the hospital. They allege that Dr. Dufresne often makes inappropriate comments and exhibits condescending behavior towards other healthcare staff. The hospital administration has initiated an internal investigation. Of the following actions is the most appropriate response from the medical board if the allegations are substantiated? A. The medical board should issue a formal reprimand, but allow Dr. Dufresne to continue practicing without any other disciplinary action. B. The medical board should revoke Dr. Dufresne's medical license immediately, as the allegations are severe. C. The medical board should require Dr. Dufresne to attend mandatory professional behavior workshops and issue temporary suspension if necessary. D. The medical board should ignore the allegations, as Dufresne's surgical skills are highly regarded and the behavior is not related to patient care. Answer. C. Explanation. Professional misconduct, even when not directly affecting patient care, can undermine trust and disrupt the functioning of healthcare teams. The medical board has a responsibility to ensure that physicians maintain high professional standards not only in clinical practice but also in their behavior towards colleagues and staff. If the allegations of inappropriate behavior are substantiated, the medical board should take appropriate steps to address the issue, such as requiring professional behavior training and potentially issuing a temporary suspension. This approach ensures that Dr. Dufresne is given an opportunity to correct his behavior while still safeguarding the integrity of the healthcare environment. Immediate revocation of a license should only occur in cases of more severe misconduct affecting patient safety. Question 16. Consent for surgical procedures. Mrs. Lefevre, a 50-year-old woman, is scheduled for a routine cholecystectomy. Prior to surgery, the surgeon, Dr. Petit, discusses the procedure with her and explains the potential risks. However, Mrs. Lefevre is unsure about the procedure and requests more information before providing her consent. Which of the following is the most appropriate action for Dr. Petit to take? A. Dr. Petit should proceed with the surgery, as Mrs. Lefevre's initial agreement to the procedure is sufficient. B. Dr. Petit should delay the surgery and ensure that Mrs. Lefevre fully understands the risks and benefits before she provides informed consent. C. Dr. Petit should have the hospital staff provide the necessary information to Mrs. Lefevre, as it is not the surgeon's responsibility to address her concerns. D. Dr. Petit should perform surgery without further delay, as it is standard procedure that Mrs. Lefevre agreed to. Answer. B. Explanation. Informed consent is a fundamental requirement for any medical procedure. Dr. Petit must ensure that Mrs. Lefevre has a clear understanding of the risks, benefits, and alternatives to the surgery before obtaining her consent. If she expresses uncertainty, it is the physician's duty to provide further information and allow the patient time to make an informed decision. This respects the patient's autonomy and ensures that the process is thorough and legally sound. Question 17. Handling of patient information. Dr. Morau is reviewing patient records at his office when he receives a phone call from a pharmaceutical company representative requesting information on patients who have been prescribed a specific drug. Dr. Morau is considering sharing some patient data to support a research initiative. What is the most ethical course of action for Dr. Morau? A. Dr. Morau should provide the requested information as the pharmaceutical company could benefit from the data for research purposes. B. Dr. Morau should decline to share any patient information without explicit patient consent, as patient confidentiality must be respected. C. Dr. Morau should share the information, provided he anonymizes it to protect patient identities. D. Dr. Morau should share only the data that he feels necessary for the research without seeking patient consent. Answer. B. Explanation. Patient confidentiality is a core principle in medical ethics, and patient data should not be shared without explicit consent. Dr. Morau must respect patient privacy and confidentiality and cannot disclose personal health information to third parties, including pharmaceutical companies, without obtaining consent. Even anonymizing the data does not fully protect patient privacy, as patients must be given the opportunity to consent to the sharing of their information. Question 18. Ethical dilemma in emergency medicine. In the emergency room, a patient, Mr. Martin, arrives with severe injuries from a car accident and requires immediate surgery. However, he is unconscious and does not have a legal representative available to provide consent. The attending physician, Dr. Leclerc, believes that immediate surgery is necessary to save the patient's life. What is the most ethical course of action for Dr. Leclerc? A. Dr. Leclerc should proceed with the surgery without waiting for consent, as it is an emergency situation. B. Dr. Leclerc should wait for the patient's legal representative to arrive and provide consent. C. Dr. Leclerc should perform the surgery only if the patient's family provides verbal consent over the phone. D. Dr. Leclerc should seek permission from another healthcare provider to proceed with the surgery. Answer. A. Explanation. In emergency situations where a patient is unable to provide consent and immediate treatment is required to prevent harm or death, medical professionals are permitted to act without explicit consent under the principle of implied consent. Dr. Leclerc can proceed with the surgery to save Mr. Martin's life as long as it is medically necessary. The ethical obligation to provide life-saving treatment outweighs the need for full consent in such urgent cases. Question 19. Reporting suspected abuse. Dr. Rousseau suspects that one of her pediatric patients, a 7-year-old boy, is being abused by his parents. The child exhibits physical signs of neglect, and he has provided conflicting stories about his injuries. What should Dr. Rousseau do in this situation? A. Dr. Rousseau should discuss her suspicions with the child's parents and ask for an explanation. B. Dr. Rousseau should immediately report the suspected abuse to the appropriate authorities as mandated by law. C. Dr. Rousseau should wait for further signs of abuse before taking any action. D. Dr. Rousseau should only report the abuse if the child confirms that the injuries were caused by the parents. Answer. B. Explanation. Medical professionals are legally obligated to report suspected child abuse to the appropriate authorities, even if the evidence is not conclusive. Dr. Rousseau's suspicions and the signs of neglect warrant an immediate report to Child Protective Services or law enforcement. Failure to report suspected abuse can have serious legal and ethical consequences, and the safety of the child should be the top priority. Question 20. Patient autonomy and life-sustaining treatment. Mr. Bellamy, a 65-year-old man, has been diagnosed with end-stage heart failure. He is alert and conscious and has expressed a desire to discontinue all life-sustaining treatments, including his ventilator, despite the fact that his family members are strongly opposed to his decision. What should the healthcare team do in this situation? A. The healthcare team should respect Mr. Bellamy's wishes and withdraw life-sustaining treatments, as he has the right to make decisions about his care. B. The healthcare team should ignore Mr. Bellamy's wishes and continue life-sustaining treatments because his family disagrees with his decision. C. The healthcare team should seek court order to overrule Mr. Bellamy's decision, as his family's wishes are more important. D. The healthcare team should continue life-sustaining treatments for short time while further discussions with the family take place. Answer. Explanation. Patient autonomy is a core principle in medical ethics, and Mr. Bellamy has the right to make decisions regarding his own care, even if his family disagrees. The healthcare team must respect his informed decision to discontinue life-sustaining treatments, while it is important to ensure that the patient fully understands the implications of his decision. The team must ultimately honor his wishes and support him through the process in ethical and legal standards. Question 21. Handling confidentiality in medical research. Dr. Pierre is conducting a clinical trial on a new medication for diabetes. He has obtained informed consent from the participants, but during the study he encounters a situation where the medication appears to cause a significant adverse reaction in a small subset of patients. The study is ongoing, and Dr. Pierre is considering whether he should share the findings with the participants. Despite the fact that the data is not yet conclusive, what is the most appropriate course of action? A. Dr. Pierre should immediately disclose the adverse reaction to the participants to ensure they are aware of potential risks even if the data is inconclusive. B. Dr. Pierre should continue the study and disclose the findings only after the data has been finalized and peer-reviewed. C. Dr. Pierre should withhold the findings from the participants and only inform the regulatory authorities. D. Dr. Pierre should share the findings with the participants, consulting with the sponsor of the clinical trial. Answer A. Explanation. In clinical trials, participants have the right to be informed of any significant risks or adverse reactions associated with the treatment, even if the data is preliminary. Dr. Pierre has an ethical obligation to disclose any potential harm to the participants, as this allows them to make informed decisions about whether to continue with the study. Transparency in research is crucial to uphold the participants' autonomy and protect it. Question 22. Ethical implications of telemedicine. Dr. Lefebvre is a primary care physician who has recently started offering telemedicine consultations for routine checkups. One of her patients, Ms. Dupont, requests a telemedicine consultation for a new condition that requires a physical examination. Dr. Lefebvre feels that she cannot accurately assess the condition without an in-person visit. What is the most ethical course of it for Dr. Lefebvre? A. Dr. Lefebvre should proceed with the telemedicine consultation and attempt to make a diagnosis based on the patient's description of symptoms. B. Dr. Lefebvre should refer Ms. Dupont for an in-person examination, as physical exam is required to make an accurate diagnosis. C. Dr. Lefebvre should schedule telemedicine consultation but tell Ms. Dupont that the diagnosis may be incomplete. D. Dr. Lefebvre should decline telemedicine consultation and suggest full in-person consultation without any further discussion. Answer. B. Explanation. Telemedicine is a valuable tool for providing care, but it has limitations, particularly when a physical examination is necessary for accurate diagnosis. Dr. Lefebvre must prioritize patient safety and ensure that she has the information needed to make a sound clinical judgment. If a physical exam is critical for an accurate diagnosis, Dr. Lefebvre has an ethical obligation to refer Ms. Dupont for an is it to ensure appropriate care. Question 23. Informed consent in pediatric care. Dr. Bernard, a pediatrician, is treating a 12-year-old child who requires a surgical procedure. The child's parents have given consent for the surgery, but the child has expressed concerns and is unsure whether to proceed with the treatment. The child's wishes seem to conflict with the parents' consent. How should Dr. Bernard handle this situation? A. Dr. Bernard should proceed with the surgery, as the parents have provided consent for the procedure. B. Dr. Bernard should delay the surgery and provide the child with more information to help him make an informed decision. C. Dr. Bernard should ignore the child's concerns, as parental consent is more important in this case. D. Dr. Bernard should immediately contact the hospital's legal department for advice on how to handle the situation. Answer. B. Explanation. In pediatric care, while parents typically have the authority to consent to medical treatments, the child's preferences and understanding must also be taken into consideration, especially as the child matures and develops decision-making capacity. Dr. Bernard has an ethical duty to assess the child's ability to understand the procedure and address his concerns. This is part of ensuring that the child's autonomy is respected and decision-making processes in the best interest of the child. Question 24. Medical professionalism and conflicts of interest. Dr. Hamid is an orthopedic surgeon who is a paid consultant for a medical device company that manufactures joint replacement implants. The patient, Mr. Dubois, requires joint replacement surgery, and Dr. Hamid recommends the implants produced by the company with which he has a financial relationship. Mr. Dubois is unaware of this conflict of interest. Is the most ethical course of action for Dr. Hamid? A. Dr. Hamid should disclose his financial relationship to Mr. Dubois to allow the patient to make an informed decision. B. Dr. Hamid should proceed with the recommendation without disclosure, as the implants are medically appropriate for the surgery. C. Dr. Hamid should avoid recommending the implants and suggest alternative options to prevent any appearance of conflict of interest. D. Dr. Hamid should ask his colleague to recommend the implants will remove any perception of a conflict of interest. Answer A. Explanation. Ethical medical practice requires full transparency about potential conflicts of interest, especially when financial incentives are involved. Dr. Hamid has a duty to disclose his relationship with the medical device company to Mr. Dubois, ensuring that the patient can make an informed decision about the surgery and the choice of implants. Even though the implants may be medically appropriate, failing to disclose the conflict undermines trust in patient autonomy. Question 25. Ethical dilemmas in end-of-life care. Mr. Leclerc, a terminally ill patient with advanced cancer, has expressed a desire to stop all treatments and enter hospice care. His family, however, insists that he continue aggressive treatments in the hopes of extending his life. What is the most ethical course of action for the healthcare team? A. The healthcare team should respect Mr. Leclerc's wishes and transition him to hospice care. B. The healthcare team should continue aggressive treatments as the family believes it is in the patient's best interest. C. The healthcare team should attempt to mediate between the patient and the family and make decision based on family consensus. D. The healthcare team should seek legal opinion to override the patient's decision as the family has more authority in this case. Answer. Explanation. Patient autonomy is a key ethical principle, especially in end-of-life care. Mr. Leclerc has the right to make decisions about his treatment, including the decision to cease aggressive interventions and transition to hospice care. While the family's concerns should be acknowledged, the healthcare team must prioritize the patient's wishes and provide compassionate care that aligns with his values and preferences. Question 26. Ethical decision-making in organ donation. The 35-year-old patient, Mr. Vasseur, is declared brain dead following a severe accident. His family agrees to organ donation, but Mr. Vasseur's medical records show that he previously expressed strong opposition to organ donation due to personal beliefs. What is the most ethical course of action for the healthcare team? A. The healthcare team should proceed with the organ donation as the family has consented, overriding Mr. Vasseur's previous wishes. B. The healthcare team should honor Mr. Vasseur's wishes and decline organ donation despite the family's consent. C. The healthcare team should attempt to mediate between the family and Mr. Vasseur's wishes, attempting to change his beliefs. D. The healthcare team should discuss the situation with the hospital's ethics committee for guidance how to proceed. Answer. B. Explanation. Patient autonomy is fundamental in medical ethics. Even though the family has given consent, Mr. Vasseur previously expressed opposition to organ donation and his wishes should take precedence. The healthcare team must respect his personal beliefs and decisions unless he had explicitly waived his rights to make such decisions, e.g., through legal documentation like an organ donation card. This scenario requires honoring the patient's autonomy above family preferences. Question 27. Cultural sensitivity in end-of-life care. Mrs. Chowdhury, an elderly patient of South Asian descent, has been diagnosed with terminal cancer. Her family requests that the patient not be informed about the diagnosis as it is against their cultural beliefs to share such information with patients. How should the healthcare team handle this situation? A. The healthcare team should respect the family's wishes and withhold the diagnosis from Mrs. Chowdhury. B. The healthcare team should inform Mrs. Chowdhury about her diagnosis as she has the right to know the truth about her health. C. The healthcare team should seek compromise by partially informing Mrs. Chowdhury about her diagnosis while respecting the family's wishes. D. The healthcare team should refer the case to the hospital's cultural sensitivity for further advice. Answer. B. Explanation. While cultural beliefs must be respected, patient autonomy remains a core principle. Mrs. Chowdhury has the right to know about her diagnosis as this information is crucial for making informed decisions about her care. The healthcare team should engage with the family respectfully and explain the importance of transparency while also offering support to navigate cultural sensitivities. However, withholding the diagnosis violate the patient's right to make informed choices. Question 20. Ethical issues in psychiatric care. Dr. Langlois, a psychiatrist, is treating a patient, Mr. Fournier, who has a history of severe depression. During a therapy session, Mr. Fournier admits that he is considering suicide but states that he does not want his family to be informed. What is the most ethical course of action for Dr. Langlois? A. Dr. Langlois should respect Mr. Fournier's wishes and not inform his family as confidentiality is paramount. B. Dr. Langlois should inform Mr. Fournier's family immediately as this is a life-threatening situation. C. Dr. Langlois should attempt to talk Mr. Fournier out of suicide but not disclose the information to anyone. D. Dr. Langlois should seek immediate guidance from the hospital's legal department before deciding where to inform the family. Answer B. Explanation. In psychiatric care, patient safety is paramount. If a patient expresses suicidal intent, the healthcare provider must take immediate action to prevent harm. What confidentiality is important, it is not absolute when the patient's life is at risk. Dr. Langlois has an ethical obligation to break confidentiality if necessary to protect Mr. Fournier's life. This may include informing the family or involving other professionals to ensure safety. Question 29. Ethical challenges in informed consent. Dr. Berlanga is conducting a clinical trial for a new drug that may help treat a rare disease. One of the trial participants, Mr. Roy, has difficulty understanding the complex medical language used in the consent form. Despite attempts to simplify the information, Mr. Roy is still unclear about the potential risks of the drug. What is the most ethical action for Dr. Berlanga? A Dr. Berlanga should proceed with the trial and assume that Mr. Roy understands the risks. B. Dr. Berlanga should provide Mr. Roy with additional time and support to ensure that he fully understands the risks before proceeding. C. Dr. Berlanga should ask Mr. Roy to sign the consent form explaining that it is standard procedure and not important to fully understand the risks. D. Dr. Berlanga should exclude Mr. Roy from the trial as unable to fully understand the risks. Answer B. Explanation. Informed consent is a critical part of medical ethics. Patients must fully understand the potential risks and benefits of participation before consenting to a treatment or trial. Dr. Berlanga has an ethical duty to ensure that Mr. Roy is given adequate time and assistance to comprehend the consent form. If Mr. Roy still cannot understand the risks, he should not be included in the trial until he has received appropriate clarification. Question 30. Managing conflicts between medical ethics and legal requirements. Dr. Dupont is a physician working in a state where physician-assisted suicide is legal under certain conditions. The terminally ill patient, Ms. Martin, requests assistance in ending her life, stating that she has unbearable pain. Dr. Dupont feels that assisted suicide is ethically wrong and against his personal beliefs. What is the most ethical course of action for Dupont? A. Dr. Dupont should proceed with the patient's request, as it is legal in the state. B. Dr. Dupont should refuse the patient's request based on his personal ethical beliefs, even though it is legal. C. Dr. Dupont should refer the patient to another physician who is willing to assist with the request. D. Dr. Dupont should contact the state medical board to seek clarification on his duties in this situation. Answer C. Explanation. Physician-assisted suicide is a legally and ethically complex issue. While Dr. Dupont may have personal moral objections to assisted suicide, he must respect the patient's autonomy and right to make decisions about her care. The most ethical action is for Dr. Dupont to refer Ms. Martin to another physician who is willing to honor her request while ensuring that the legal requirements are met. This allows Dr. Dupont to maintain his ethical integrity while respecting the patient's choices.